Hi guys, I'm Dr. Tahir, and today what we're going to be doing is doing a mock consultation. So we'll be showing you a new patient come in, we'll be taking their initial history and seeing what their complaint is, what their problem is, and tackling how we come to a diagnosis and what our next steps are from there. So the goal of this video is to pick the mind of a dentist and understand when a dentist is doing an exam, what they're intending to find and what all of them findings mean. Sagar, how are you?
Hi, not the best, to be honest with you, doctor. It's got really bad pain on my side.
Okay. Okay, I'm sorry to hear that. So let's try to figure out what's causing that. So you said on the left side, is that at the
at
the top or the bottom? Or?
At bottom.
Bottom, okay. And what's caused this pain? What's happened?
I mean, I first noticed it when I was drinking tea.
Okay.
Just a really just sharp pain. Like I felt like I was getting stabbed.
Okay.
Yeah, I mean.
Okay.
Yeah, that was
right. So
nice.
You've not suffered any damage to the tooth. You've not hurt yourself.
No.
It's just happened. Okay.
Just happened. Yeah.
Okay. And does this pain spread anywhere else? Does it, go to the other teeth? Can you pinpoint what tooth it is?
I'd say it's like a throbbing sensation.
Okay.
But I just know it's towards the back.
Okay. And you said it's sharp.
Yeah.
And is there, anything else that's associated with this pain? Do you get headaches? Have you tasted something funny in your mouth? Is there anything else that can associate with it?
I haven't really been able to sleep.
Okay.
So I think I've been getting headaches because of the lack of sleep.
Right, okay.
But it does keep you up at night.
Yeah, and does it ever wake you out of your sleep if you do fall asleep? Okay.
Yeah.
That's okay. And how long does this pain last? So you said when you have tea it hurts. Does it hurt just whilst you're having your tea, or does it stay after as well?
It stays a good while after. So I've been consuming painkillers.
Right,
but
okay.
no, it doesn't seem to work.
And the painkillers aren't helping?
It's not, no.
And I'm assuming that's ibuprofen or paracetamol?
Both.
Okay.
Yeah.
That's fine. And is there anything that makes the pain worse? So you said sweet things. What about cold things? What about anything else?
To be honest, I had the heart, and that definitely hurt. To be honest, me being like this, lying back, that hurts it a bit as well.
Lying back hurts it more.
Yeah.
Okay, thank you for telling me that. That's good to know as well. And finally, last question. How bad is this pain from 1 to 10?
It's genuinely the worst pain I've felt.
Okay.
Fair enough, I haven't broken many bones in my body, but 20 out of 10.
Okay, and you've not felt any swellings in that region or anything oozing out or anything like that?
I haven't felt like pus.
Yeah.
I think maybe when I brush it bleeds and stuff, but I don't know.
Okay, that's fine. Thank you very much. So there we went through the pain history with Sagar, and we went through a model called Socrates, where we go through different aspects and try to find different giveaway signs as to what the diagnosis could be. The first thing we went through is site, so where the pain is located. After that we went through onset, so when the pain started. C for character, what is the pain like? Is it sharp? Is it dull? R for radiation, so does the pain go anywhere else or does it spread? A for associations, is the pain associated with any other smells or signs in the mouth, any headaches of that sort? T for time, how long has the pain been there? When did it start? E for exacerbating factors, so does anything make the pain better? Does it make it worse? Do any medications help? And then S for severity, how bad is the pain from 1 to 10? So based on the findings we had from Sagar, we could rule a few things out. For example, he said that the pain wakes him up at night. He said that the pain is a 10 out of 10. And he said that the pain comes and lingers a while after the stimulus is removed. For example, the hot drink or cold drink. This makes us think it's something more like irreversible pulpitis as opposed to reversible pulpitis, and this means that the tooth is decayed to an extent where it now needs a root canal probably, or depending on the tooth, it may need a different treatment as well. This isn't a definitive diagnosis, it's just a guide and a direction as to what it could be, and it kind of rules different things out. From here on, we would take x-rays and do more special tests such as the cold test, which we won't fully go through in this video, but we'll do future videos on them, and this will show how technology in dentistry can also help the clinician come to a conclusion. So Sagar, thank you for explaining your pain history. I'm just going to ask you a few questions about your medical history now, if that's okay.
Yeah.
So have you got any medical conditions that I need to be aware of?
I have asthma.
Asthma, okay,
Yeah,
thank you for that. Yeah, okay. I'll ask you a few more questions about that. Just before that, have you got any other sort of bleeding conditions, heart conditions, anything else you want to mention at all?
I've just got asthma, I've got allergies.
Okay, let's talk about the asthma. Have you ever been hospitalized for your asthma?
No.
No, okay. And how frequently do you have asthma attacks?
Not very frequent. Maybe when it's like very cold, or if I'm doing like a big like exercise activity, then
yeah,
maybe I'll take a little.
Do you use the blue inhaler or the brown inhaler?
Blue one.
Blue one. And do you have that with you today?
Yeah.
Okay. If at any point there's anything that discomforts you, let me know.
I mean, look, the allergies I've got is I've got nuts. I have asthma. The gloves. Latex allergy.
Okay.
I actually found out about that like last time I came to the dentist.
Right. Okay. So the next step of the consultation, and one of the most crucial steps, was taking the medical history. This is very important. Before we ever put our hands on the patient, we want to know how they are medically. So you would have heard me ask about Sagar, whether he's got any sort of medical conditions, heart, any brain conditions, any lung conditions, blood conditions, anything at all. He mentioned he has asthma. Now, asthma is a very big condition when it comes to dentistry. Obviously, all of them are big, but asthma especially, there's a lot of associations that a dentist needs to be aware of. For example, fluoride varnish, which is something that we rub over the teeth to give them a bit of extra strength and reduce sensitivity, that can have something called colophony in it. Now, patients with asthma can be allergic to this colophony, and therefore it could, mean that their treatment is, it could mean that we take a different route of treatment. Also, the patient takes a blue inhaler. This was very important because it means that if they were to ever have a medical emergency where their asthma attack kicks in the practice, we need to make sure that we know which inhaler they take, whether they have their inhaler with them, and obviously if they have their inhaler with them, and we advise them that they can always use it in case of an emergency. You heard me ask about whether he's been hospitalized or anything of that sort, and that makes me know as a clinician whether I need to be worried about this patient and maybe say, you know what, it's not in my capability to treat them, I want to send them to a hospital where it's safer. Or if it's like Sagar's scenario where he's never been to a hospital, I can be like, okay, I'm a bit more confident and I can treat this patient here. And I think nuts, very important, because we want to know just in case, nuts can just crop up anywhere. So if there's any, and then latex allergy, very important. Again, nowadays a lot of stuff is latex free, but you never know. The practice could just order one box of non-latex free things, and you just want to make sure with the right patients you've got the right things. Right, Sagar, so just a few questions about your social history, if that's okay. So, do you smoke at all?
No.
Okay, and have you smoked previously?
Nope.
Nope. Do you drink at all?
Nope.
Good. And do you take any recreational drugs?
Nope.
That's good. And do you mind me asking your occupation?
Yeah, I do sales.
Okay. And do you live alone? Do you live with family?
I live with my family.
Okay. Thank you. All, if he drinks at all, if he takes any recreational drugs. The reason I want to know about that is because obviously, as you should be aware, if you smoke and if you drink and if you do both in combination, you greatly increase your risks of oral cancer, and obviously it can also negatively impact your oral hygiene, and then also your risk of gum disease. And then in addition to that, I asked what his occupation is, and that's important because it also gives me an insight as to how much time he has to really brush his teeth. Does his job cause him anxiety, and little telltale signs like that, and who he lives with at home as well, because obviously, again, if he's got a family, then it might be a little bit harder for him if he's living alone, and that sort of thing. So a few questions about your dental history now. So first of all, are you registered with a dentist anywhere else?
No.
No? And when's the last time you saw a dentist before today?
Can't remember.
Can't remember. Okay. And just a few questions. So do you brush twice a day, once a day? Tell me about your brushing routine.
Most times I do twice a day. Maybe sometimes if I get home late, I might just go straight to bed.
Right, okay. And when you're brushing, are you using a manual toothbrush or an electric one?
Manual. Okay. I don't like the vibrations of the electric. It just makes me feel a bit.
Okay, and are you brushing, how long are you brushing for? Is it 30 seconds, a minute?
Just until I feel like it's clean, to be honest.
Okay.
I try to do all the surfaces, the outside, the inside.
Yeah.
I don't really brush my tongue that much, but.
And are you aware if your toothpaste that you're using is fluoridated?
I just used the Colgate one, to be honest.
Okay, that should be okay. And do you floss at all?
No.
You don't floss, okay. And
I tried with the string and stuff, but I just find it very complicated.
yeah, it can be difficult before you start. And when you are brushing, are you spitting out the toothpaste after, or are you putting water in and rinsing it out after you're done?
I put water, yeah, just
Putting water.
to make sure everything's out.
Okay, and my last question, your diet. Tell me about your diet. You know, do you have a lot of snacks, sugars, fizzy drinks?
I mean, you know, I'll have breakfast,
Mm-hmm.
you know, toast and eggs, you know,
Yeah.
cup of tea, whatever. And then for lunch, I'll just have a few snacks. So I have fruit, you know, Molokana, the toffee one, my favorite flavor. And then for dinner, whatever my mum cooked.
Okay, and would you say you like to have like a chocolate in between meals, crisps,
Chocolate for dessert, yeah.
dessert?
Yeah.
Okay, and you having that routinely?
Yeah.
Okay,
Yeah. to be
that's
honest,
fine.
yeah.
Thank you. Now we're going to go through the dental history side of things. So as you would have seen, I asked Sagar if he's registered at a dentist. Again, another sign to me whether, you know, he's been regularly maintaining his health and having a clinician look at it. And the last time he's seen a dentist is knowing how often he brushes is very important, because it gives me an indication as to, you know, how well the teeth are being looked after. Whether he flosses can be an indication of how well his gums are looked after. His dietary habits, you know, do they put him at risk of any sort of tooth loss, tooth surface loss, such as erosion or attrition and cavities? And, you know, just his general mindset towards brushing, because a lot of patients might be a bit of just like, oh yeah, just, you know, get it done, this and that mindset. And being like that, again, gives you a big sign as to how much push you need to give them as a clinician. Another very, I would say, important thing to pick up from taking the dental history is when a patient is all the way at this side of the spectrum and you want to get them to there, it might be easy for you to say, okay, you don't brush often, start brushing twice a day, and you don't floss, start flossing every day, every week. But instead, little increments and setting goals and knowing that this patient is going to appreciate that little jump and you're going to reward them for that will mean that they are more likely to come back and, you know, meet the next target and the next target rather than making that big jump. And this small goal setting and positive reinforcement can really help bring behavior change about. And all of that stems from this nice, thorough conversation where you take the dental history in the first place. After this, what we would have done is done an intraoral check and extraoral check, where we're just making sure the mouth is okay and what we assume is really there. Extraorally, we want to look for any other signs of things going on that could be affecting the mouth and the general health. And then we'd go on to take x-rays, and all of this extra information would help us come to a diagnosis and make a treatment plan for that patient. We won't be showing you that today, but the goal of today's video was to show you how, when we take a history, what the dentist is thinking, what their idea is behind every single question that's asked. Every single question, every single conversation has purpose, and it's to not only just build that rapport, but also it gets the dentist thinking, how am I best going to manage this patient? And finally, in the treatment planning stage, our goal is to stabilize the patient and make sure they're healthy and disease-free. And after that, we can make it look all good and pretty, and then focus on making the patient feel better and look better and maintain their long-term oral hygiene. Thank you guys for watching. We hope that was beneficial, and we'll hopefully see you in the next one.